Good day. I'm Milton Schoen, and welcome to America Salutes. I'm the Director of Hennepin County Veterans Service, and today as our guest we have Vicki Davidson, who is the Admissions Coordinator for the Minnesota Veterans Home, Hastings. Welcome to our show, Vicki.
Thank you. Thank you for asking me to come and talk about our facility.
And why don't you tell us a little bit about your background?
I have a nursing background. I've worked at the Veterans Home in Hastings for the last 10 years, the last 4 in the admissions office.
And the Hastings campus is unique. The other veterans homes all have nursing that's part of their facility. And why don't you explain what is unique about the Hastings campus?
Well, the Hastings, we are a board and care facility. Our veterans are a very diverse population. They may not require skilled nursing care, such as a nursing home, but they do have some type of medical or clinical need. Many are working on mental health, sobriety, voc rehab. So they have different needs, but they still also have to have a medical or clinical need.
And you have, as I understand it, 128 acre secluded campus?
Correct.
And it is a unique environment for people that they can walk and be connected to nature, and it affords that to its residents.
It does. It's a small, Hastings is a small, cozy community, not just minutes from the Twin Cities, but yet it offers the small town feeling. We have nature trails, we have bike paths, walking paths, parks in close distance. It's a very safe environment for our veterans.
Very good. Well, why don't you take us through, if I'm a veteran or a family member of a veteran and I want to have them admitted to Hastings, what would I need to do, or what would the veteran need to do?
The first thing they would need to do is complete an application for the facility. Applications can be found online at the minnesotaveteran.org, or they can contact the Hastings Veterans Home, and I can send out a packet to them, or they can certainly stop by and pick up a packet. So once they complete an application, they would have release of information forms, so we can request medical records from anywhere that they've had medical care in the last 6 months. And there's a form in our packet called a Statement of Medical Need, and their medical provider would complete that, stating what the medical need is and that it could be met at a board and care level. We also would need a copy of the veteran's DD-214, their discharge paper, showing that they were honorably discharged with a minimum of 181 days consecutive active duty, unless they were discharged earlier due to a medical disability incurred during the line of duty.
So as long as they meet the Minnesota definition of a veteran and they've got a medical need for being there,
correct,
they can be admitted. And if I wanted to view the facility before I filled out an application, is it possible for people to tour the campus?
Yes, and I highly encourage that. If anyone's interested in coming to see our facility, just please contact me at the Veterans Home. I can be reached at 651-539-2500, and I would be more than happy to give you a tour of our facility.
Very good.
And help you with any paperwork that some people need help filling out the applications. I'd be more than happy to assist where I can.
And you have a number of programs at your facility, such as the woodworking shop that I'm familiar with because of the flag cases that you make available throughout the state. Yes,
it's very unique to our home, and that's our veterans work in the veterans wood shop, and that's where they make those flag cases and memorabilia cases, and they've shipped those all over the world. They also take special orders. They'll make picture frames, bookcases, other woodworking, and it's really wonderful. It gives them a chance to enhance their woodworking skills, and it provides a great opportunity for the veteran and the public who wants to purchase the items. So if any public is interested, they can contact our home and place an order.
Good. Some of our listeners may think of a veterans home such as Hastings as a place where somebody would come at age 40 or 45 and be there at 65. And you were telling me earlier today that that's not the case, and that many of your residents transition to the community.
That's correct, and that's what we work on. We work on providing high quality care and service with a focus on rehabilitation and reintegration into the community. And we also have supportive care to empower them. And so we work on, they have work therapy jobs, they have assistance with job applications, job interviewing. We have a wonderful voc rehab department that assists our veterans in finding employment, competitive employment in the community. We've had a number of successful veterans. We've had a group that actually went to Cordon Bleu cooking class, and one of our veterans is actually working in a little restaurant in Hastings as a cook as a result of that.
Very, very good. And in addition to the vocational rehabilitation, one of the things that's a hallmark of your home is that people are connected to the VA healthcare system. As I understand it, you provide transportation to get people over to the Minneapolis VA Medical Center?
We do, but the nice part is our veterans actually receive their primary care at our facility. We are very fortunate to have nurse practitioners on staff, so our veterans would receive primary care in our facility, and then our van goes up to the Minneapolis VA 3 times a day for any specialty appointments in lab work, x-rays, but all their medical care. And we have nursing staff 24/7 that helps with medication management, education, individualized health goals.
And the other piece with the Veterans Home is you're very connected to the community, in our case the veterans community, and there are many donations of time and effort that these organizations give to the home and to the residents.
Absolutely. We are very fortunate. We have a great group of volunteers that offer their time, experience, and companionship to our veterans. We have organization groups, like you said, that come and put on bingos, and they'll do ice cream socials. We have, from the Hastings Public Schools, the kids come during the school year and they'll play games or just have companionship for our veterans. And on the other hand, our veterans also do volunteer. They'll collect for the Hastings food, Hastings Family Services. They'll collect a food drive. They've done a mitten tree where they've collected winter gear. They've done school supply drives. They've gone to Animal Ark, which is an animal shelter in town, and they play with the cats, the dogs, the animals. They've done highway cleanup, Meals on Wheels. So it's very nice to have our veterans have those volunteer opportunities too.
Right. And so the home, one of the pluses is that you're working to allow individuals to be as independent as they possibly can.
Absolutely. We want them to achieve their highest level of physical, mental functioning and to maintain their independence for as long as possible.
And that's the model you're operating off of.
Absolutely.
And you've had some substantial remodeling of the campus recently, and as you were saying earlier, you mentioned the clinic that is relatively new.
Yeah, and our veterans have, it's set up like a doctor's office now. They actually have very nice exam rooms, very nice waiting area. So it's separate from where they would have to go get their medications. So it's more convenient and more personal and private for the veteran.
And you know, if I was applying, one of the first questions I might ask is there a waiting time at the present time?
There is not a waiting time because there are beds available, but there is the admission process, meaning they would have to fill out that application. We would have to receive their medical records. So there's not a waiting list per se, but you can't just call me, say, today and expect you'll get in tomorrow. But we try to make it as quick as possible.
But it's not like it's a 6-month wait or an 8-month wait.
Absolutely not.
Very good. Well, in our last minute or so, if you wanted to leave our viewers with one thought, what would that be?
Well, on behalf of the Veterans Home in Hastings, I would like to thank all our veterans for their service, and also to the current military members, we'd like to thank them for their service. And if any veteran or family member or case manager, social worker is interested in finding out more about our facility or would like a tour, I would be more than happy to show around our facility.
Very good. And they would, to contact you, they'd need to call what number?
The 651-539-2500. And that would be a direct number to my office.
Very good. Well, we've been speaking with Vicki Davidson today from the Minnesota Veterans Home Hastings, and I want to thank you for informing our viewers. We hope that this first segment has been informative to our viewers, and we look forward to our next guest. Thank you.
Great. Thank you.